Hi everyone, we are back with another episode of Health Beyond Borders podcast brought to you by Malaysia Healthcare Travel Council. And I am Hamidah, your host for today. And with us, we have Dr. Sharifah Halimah Jaafar that we brought in special for you to talk about the breakthrough treatments for endometriosis and women's health. Hello, Doctor.
Hello, yeah, hello.
So, maybe before we go deep into the topic,
Mm-hmm.
I can just ask you about yourself and maybe a brief introduction on how you got into the field and your years of experience.
Yeah, okay. Thank you so much for inviting me. Okay, of course, you already introduced, I'm Dr. Sharifah Halimah Jaafar, and I am an advanced minimally invasive robotic and endometriosis surgeon or specialist currently working in Hospital Picasso. Of course, based on the experience, I have been working for the last 30 years. Now, out
Wow.
of these 30 years, 20 years is in obstetric and gynecology.
Mm.
So I become endometriosis or advanced minimally invasive surgeon or specialist about 7 years ago,
Mm.
and I specialize in endometriosis after I have become robotic surgeon about 4 years ago.
Okay, so basically today we're going to talk a lot about endometriosis. So maybe we can have you clear the air on maybe there are some confusion on this particular term.
Mm-hmm.
What is endometriosis? Is it an organ? Is it a disease? Is it menstrual cramps? Is it PMS? Are they all different, totally different things or the same thing?
Yeah, endometriosis actually it is a multi-organ or multi-system disease.
Mm.
So it's not just in reproductive. Of course, it starts in the reproductive system, but it can involve multiple organ, which is the bladder. It can also involve the bowel. It can also involve the ureter. It also can be also the kidney. It can also goes up to the thorax, to the diaphragm, and it can actually happen everywhere. And the worst scenario, it also affect the nerve
Oh.
in the pelvis that cause a lot of dysfunction in our patient. It is a chronic inflammatory disease, cyclical. I
Mm-hmm.
mean, it flare every month, and it is progressive. So
Mm-mm.
it get worse over time.
Mm-mm.
So this is endometriosis. It is a disease.
Mm-hmm.
Yeah. Okay. Which involve multiple system and causing it paralyze the patient life and put the patient into a stall due to the symptom of disease and the complication of it.
I see.
Not to
So,
mention about infertility and so on.
mm-hmm.
So the statistic has shown about 10% of women in the reproductive age group, so it means young women, right?
Mm-mm.
So of the age of say 18 to 45, affected by this disease. So and because they are young, they are in the prime age, right? So this is the time where women begin to want to start their career,
Yeah.
want to start getting married, want to start to have a children, want to start their life. Yep, maybe trying to get financial independent, grow their career or become something or meet their dream. But this is the time that they actually being under siege
Limited
by
by,
their
yeah.
life being
Mm-mm.
under siege, and they are not able to move on because of the disease.
Okay, so does that mean, because I think we all agree that having menstrual cramps is common uh, among women. So to the extent that we feel that it's normal for you to have it every
Mm.
month, but to what extent is it normal?
Mm.
Or does that mean every person who are dealing with menstrual cramps every month have endometriosis, or ada scale? There's the scale that
Mm.
to this extent, yes, you have endometriosis, or no, you just have like normal, yeah.
Okay, 90% of women with endometriosis present with menstrual pain, okay, or
Mm.
period pain, right? Of
Mm-mm.
course, another 10% are completely asymptomatic.
Oh.
I mean, they don't have the disease, they don't have the symptom, but they have the disease.
Oh, okay.
Right? And presentation to one woman to another woman also are they're very different. But
Yeah.
90% of it, according to our studies and also literatures, that women experience menstrual pain as a symptom. So the problem is delayed diagnosis, right? So this is a problem. So because the reason being women has been bombarded from young that period pain is normal, like as you mentioned just now,
Yeah.
because you think period pain is normal, that everyone should bear some pain because that we having a period. So people think their period pain is the same, everyone has the same period
Yes.
amount of period pain. So that's why we said that there is something differentiate between normal pain, normal menstruation, and also the pathological. So we call physiological pain and pathological pain. So normal period, not all having pain, not having all having a symptom. Not, some patient can be, some women also can be so painless without any pain. But there are people who doesn't have endometriosis also have some pain, but their pain is not until incapacitating them, right?
Oh.
So the pain maybe they can just relieve by paracetamol. That the one thing, and this does not escalate into more severe over a time. So by simple measures, this pain can be managed. And then maybe if we can grade the pain, usually we ask the patient how bad the pain. We want to measure the pain, right? Because one woman to another will be different, so we need to measure it. So we have a pain score. So we ask the patient, okay, what is your pain score? 0 to no pain, 10 to most painful. So most of the patient who has a physiological pain due to menstrual period, okay, then maybe their pain score is around 2 or 3, the most 4, right? And they relieve by usually whatever measures the woman. Sometimes they just bear with it. But endometriosis is another story. Their pain, most of the time, you ask them, they will say 6, 7, 8. Some people even say 11. I mean, they even
Beyond
shoot the
the
roof beyond
score.
the score
Yeah.
or something. So whenever you have period pain that actually incapacitating, that you cannot go on with your work, you cannot go to school, and you cannot do your daily activity, and then you cannot even plan your month or your week. You cannot plan your work, and it get worse over time. So this is pathological. You need to see it. This is a
Seek help.
symptom.
Yeah.
The body tell you something is wrong. So then we need to differentiate this, because this is a symptom would tell you that something wrong inside that you need to recheck.
But also at the same time, like you mentioned just now, there are asymptomatic cases.
Yes,
So
but
how did they come to you? Because they are not, getting all these
yes.
symptoms.
So 10% around that women are completely asymptomatic. They have full blown disease, stage 4 disease, but they're completely zero pain. So these women are, this kind of case are very dangerous because they
Yeah.
don't feel
Yeah, yeah,
any
yeah.
symptoms. So when they come, when they have complications, so it means the symptom of complication. So what is it? What are the symptoms? When they want to pass, difficult to bowel open, then they can have painful when they do maturation, or they can even have intestinal obstruction. They can have kidney damage, because it's silent kidney damage is also very common, where they can have the ureter actually get stenosis or obstructed by the disease from the outside, or also can even grow inside. They completely blocked, so the urine cannot go down to the bladder. So then the kidney will get swollen up and eventually fail without the patient notice. So the patient will come with sign of kidney disease, for example. Their patient come with the bowel problem, like because of their half of their bowel get obstructed, so they can have like with the bloated sensation or constipation and or chronic pelvic pain, or maybe they can have it shooting pain because now it's involving the nerve, shooting pain to the leg. They're unable to do their activity. So these are complicated symptom. Instead of just if they come earlier, if they have period pain earlier, they could have come earlier. Then maybe we can detect that earlier. So this is much more dangerous when they have no symptom.
So there are different types of endometriosis, as in like well, like you said, if we come early and we can get the checkup, or it has progressed to a certain stage, so it's kind of similar to cancer.
Okay, endometriosis is not just endometriosis. You see, it's not just it doesn't present in because we call it many phases or many phenotype. Yeah, many phenotype, not just because we have a uterus, they have ovary, and they also have a bladder. They have also the uterus. They also have the ligament there. So endometriosis can come with the symptom like just a superficial, which is just a spot lesion in the, so we call it grade 1 spot lesion. That can be very painful to some patient. Minimal disease, but the symptom can be like as a stage 4 disease. That depend on the patient. So some people will already have the what do you call this, the ovarian cyst or chocolate cyst, which is involving the endometriosis involving their ovary. They forming a chocolate blood collection in the ovary, and it can be one ovary or it can be two ovary, and damaging their fertility potential. They are damaging their egg, their follicles, that making them infertile, and that is ovarian endometrioma. Some also may have uh, deep disease. This is the most dangerous. We call it deeply infiltrating endometriosis, where they have the disease actually infiltrated more than 5 millimeter down to the retroperitoneal structures, which is their ligament, their nerve, the bowel, which is the rectum, which is so nearby, and then it also can penetrate on the front to the bladder. It can penetrate into the bladder, and it also can go to the side where it can strangulate the urethra, left and right. So that's how. So this is the deep disease, and they can also associated or commonly we call it adenomyosis, which is the endometriosis in the muscle of the uterus. So most of the women will come not just by single entity. I mean that not just single phase superficial endometriosis. If they come early, maybe we can see just superficial endometriosis. But most women will come with all the entity is at the same time. I mean they have a bowel disease, they have the uterus disease, which is
So everything is
adenomyosis, they
disrupted.
have the ovarian disease, which is the chocolate cyst, and
Yeah.
which is destroy their tube or their fertility, and they also have the deep disease, which is the bowel disease, and then the urethra, and so on. So this is the problem, okay, because most women delay or take time, or
Yeah.
maybe assuming their pain is normal
Normal.
until they end up with all these multiple disease manifest as one entity, endometriosis, deeply infiltrating endometriosis.
I think this is what many of us are not aware, even myself. Now that you've explained this, I always assume when you say endometriosis is just something that has to do with your uterus. So apparently, it affects
Yeah.
all the organs
Yes.
surrounding the uterus, and yeah, you need to get it checked
Yes, you get it checked.
early.
Yes.
But
I just mentioned it just equate to like kind of chewing gum, right? When you eat the chewing gum,
ah,
endometriosis are just like this. We call it endometriosis nodule. So it's just like a chewing gum
that's
inside,
stuck
and then
to
they
everything.
just get stuck,
Yeah,
chewing gum here, chewing gum there. So
yeah.
it stick, all the bowel to the uterus, to the ovaries, and everything end up become, we call it frozen pelvis. So everything was just being glued together. So can you imagine that? They
So
bring
for you to
everything.
treat that, you need all kinds of specialists to come together and work it out.
Yeah, if they come, in that stage, of course, we have to not only endometriosis specialist, we also must have, if they involve the bowel, then we need to have a colorectal surgeon. If they involve the urethra, we need to have the urologist to be around. Sometimes they even go up to the diaphragm, okay? So involve the diaphragm, they can even go to the lung. Then we may have to have upper GI specialist. If we may have cardiothoracic specialists also. So we have to work together because it is a multi-system disease.
Yeah. So this is what people may not realize, that it can easily affect almost your whole body
Yes.
if you don't get it checked
Yeah. Uh,
early.
Again, yeah, I just want to mention that there are some people who say, I come across some people who mentioned that maybe we should rename endometriosis. We shouldn't name it endometriosis because endometriosis means something related to the uterus.
Yeah.
Yep, okay. So because of that, people think the disease is not
This
important.
is
Maybe we
normal.
should name it different because it is a multi-system
Yes.
disease. It's not just
It's
uterus,
actually very
but
scary.
it's actually the whole
Yeah.
system. Okay.
So, I think a lot of people maybe they do think, oh, I do need help. I want to seek help or to consult somebody, a specialist, but I'm afraid or I don't know where to start. I don't know how the treatment is like. But I think that one maybe we can discuss at our next segment, okay, on how or what is the first step that you can take,
Yeah.
yeah, for this. So I think we will get back to you on that.
Welcome to Hospital Picasso, where advanced technology meets personalized, compassionate care. From the moment you enter, our warm and dedicated team is here to guide you throughout your journey. We are home to 5 specialized centers: the Breast Center, Women's Health Center, Urology Center, Gastrointestinal and Liver Center, and Cancer Center. Step into a patient-first environment, designed for your comfort and healing. With advanced diagnostic machines and medical technology throughout the hospital, every step of your care is guided by precision and safety. And at the heart of innovation is our robotic-assisted surgical system, delivering faster recovery and exceptional outcomes. Hospital Picasso, personalized care, advanced solutions.
Hi everyone, we're back. So just now I was about to ask doctor on what would be the first step if we wish to seek consultation. But I think before we go there, maybe the more important question I think everyone is wondering out there, what is the cause of endometriosis? Is it genetic or is it something to do with your lifestyle, your food intake?
Yeah, that's a very good question and very difficult to answer as well. Okay. And okay, endometriosis starts with not every woman has endometriosis, right? Just now we mentioned 10% of women. So women who has endometriosis, actually it starts with the genetic predisposition. So it means they're genetically somehow transmitted to either parent, mother or father, the gene have some defaulty genes. So they actually, because of that default gene, that patient has a different immune response towards the, what do you call this, retrograde menstruation. Of course, there will be retrograde menstruation, mean when women have period. So the uterus has a 3 outlet, right? So we have the down outlet, which is going out down, like we see period. But the uterus also got the other outlet, right? The fallopian tube. So the period, when we have period, not only do we have the blood coming down, but also the blood going outside to the abdomen wall, to abdomen.
This is if we have endometriosis.
No, in the normal patient
normal,
also. In
okay.
normal woman, we have this, most women will have this retrograde, we call it backflow or retrograde menstruation. But not all women who has this retrograde menstruation will have endometriosis. So women who has this genetic predisposition, they have different way of their immune system who manage this blood flow outside. So when the blood from the uterus going out, they also carry some stem cell of the endometrium outside to the, it gets stick to the outside of the in the abdominal cavity. In the normal women, the immune system will work to clean up this cell or the blood, the debris and this and that. This is what our immune system does. They go and clean up, right? They produce the white blood cell and they eat up and then clean before next month already done. Some people don't have that any much of pain. But in women with endometriosis, because of their defective immune system, in the way that they also try to eliminate all this debris and all the endometrial cell, but instead of they eliminate, they produce too much of fibrin and they trap the cell there. So when the cell get trapped there, the cell cannot get eliminated by the macrophage who's supposed to eat up. So the cell will be there and become alive by the feed by the normal our normal hormone. So every month when they have period, those trap also will have some period there, and they cause inflammation there also. So over the month and month, this inflammation will continue on, and then it become a nodule.
So that's what
It
makes
become
it
a fibrous
painful.
inside there got active endometriosis trapped inside. So that's why they have all these we call it satellite lesion. This lesion here, lesion there, all these are trapped disease bound by the fibrous tissue, and the disease cannot get eliminated unless we cut it off. So this endometriosis it become gummy. Just now you keep talking about as if we have the gum,
Yeah.
we have the jelly or that kind of that stick to the other organ. Whatever there, so the organ will just get stick there, and then you continue to do that every month. Every month the woman got flare. So this is how the endometriosis started. Okay, and the origin, and but it doesn't happen in the normal women. So this is it's not easy to understand, but somehow is that immune system. That's why women with endometriosis also associated with the autoimmune disease. Their risks are much higher compared to normal people. So somehow it related to their body immune system in how it works. Yeah.
Okay, so you mentioned that basically it's genetics, but do you see an increase of this kind of diagnosis with the current lifestyle that we are leading today with more processed food, sugary
Yeah.
drinks? So does that affect?
I think there is some like kind of they're not the cause, but they are maybe the contributing factors. The cause is just now we mentioned right, pre-genetic and how the body immune respond. But all these abnormal, I mean the unhealthy lifestyle, what do you call this, extra stress level and diet, so that will produce more inflammation, more because you have the inflammation, you just encourage more inflammation going to happen there. So that's why it's part of the treatment of the endometriosis is also to do some adjustment in their lifestyle, into their diet and so on. Not so much of anything, but actually to maintain uh, a low inflammation, because as they inflame, they produce more fibrin, right? So that's the basis of all these what do you call this good diet and more probiotics and so on, is to cut down the amount of inflammation, chronic inflammation that's happening every month. So that help the disease maybe not to progress into severe disease too fast, or slowing down the disease and so on. It give
But
patients some relief also.
so, but that also means that just simply by tweaking your lifestyle or your habits does not actually cure
It
the.
doesn't
So you have
cure.
to get checked, right? You still
Definitely,
have
it
to get
doesn't
checked.
cure, but it very helpful to relieve symptoms, right? To relieve symptoms, definitely, because the pain is due to chronic inflammation. Of course, at the beginning, chronic inflammation, but the moment it become complicated, they trap the nerve, right? You can trap the nerve. Of course, the nerve will cause more pain, referred pain, and then those which trap the bowel, your movement, right? Because now all this being trapped, not mobile anymore, so any movement pulling here and causing more pain. So so these are all a part of the symptom, but they all begin with inflammation, and that inflammation produce fibrin, produce a scar, forming a scar at the end of the day, and that scar causing contraction here and there. So depend on which organ are affected. So that's how the symptom manifests.
I think doctor's explanation has really visualized the pain. So I think a lot of our audience can relate and maybe feel validated that whatever we're feeling every month is not, it's not actually something normal.
Yeah.
If it has, come to an extent of that pain score that you mentioned just now. So if they are interested or they think, okay, this is the time, I need to get checked, where do they start? What is the checkup like? Maybe they want to, but they are scared that it can be invasive or it can be painful.
Yeah, okay. Yeah, many women, that is a problem. So people are so fearful to face sometimes they didn't want to know the
Yeah.
disease. Most women are scared, even like cancer. I know some patient who said that, if you have the symptom, why you're not seeing the doctors? Because I better don't know I have a cancer, because then I don't want to face it.
Yeah.
Things like that. Same thing with endometriosis, because I feel the patient know what they might have, grow inside, or they have something brewing, but they just fearful to find out. What if I have something I cannot manage?
Yeah.
So they prefer to suffer disease. But the thing, endometriosis, it doesn't reward patience. If you're too patient, the disease will continue to progress and from simple to complicated, right? Remember, you have all vital organ at
Yes.
risk,
Yeah.
like your bowel, your bladder, all this function can really derail our life, right? If it bowel dysfunction, ureter dysfunction, you can really have a life-threatening issues also at the end. So of course, we want to women to uh, own up the symptom and come early. So when they come, usually if they perhaps they don't know what's the process. Okay,
Yes.
that's why they don't want to. They are so fearful, and nowadays people have social media and tell this and that. So actually, when they come to see doctors, we should take detailed history of their symptom. Sometimes they think that the symptom is not symptom, so we shouldn't be to ask them, do you have a? And of course, they will say have a period pain, but then we can ask them, do you have a pain during bowel opening during your period? So then we say, yeah, yeah, I have. To them that is like
Not
they
not
thought
as in
it's
the yeah.
normal. So we can ask. We also ask. So we will go through all the symptoms because nowadays we want to diagnose endometriosis. We can diagnose through the patient clinical presentation. So their history and how they tell us about their manifestation, the symptom is very important because from there we can make a picture that, and it can be almost 80% accurate that we can even make a diagnosis based on clinical symptom that
Oh.
you have endometriosis by your clinical features, clinical symptom. Of course, we do physical examination. The physical examination usually involve like examine the abdomen. But if the patient is young, single, not sexually active, we're not going to do vaginal examination definitely. All right. So we just based on the abdomen examination and we do ultrasound.
Ultrasound.
But then we can see to a certain degree we can make diagnosis if the patient has ovarian cyst, very obvious ovarian cyst, the uterus. We can see it also very clearly. But the back of the uterus is just a bowel involvement, if the ligament involvement, to see it from the top. So that can be quite challenged, because the image is quite far away. So this kind of patient usually we offer MRI,
MRI.
magnified resonant imaging. All right, so that is one of the modalities that we use. Uh, yeah, so this is the process that the patient have to go through, and then after that we will discuss with the patient what I mean that she has and to what stage is her disease. MRI also is very important in diagnosing endometriosis and also staging the disease, or we call it mapping the disease, because we can see the disease in the full spectrum of it. Is it the uterus, or which compartment is involved? Is it the uterus compartment, or is it we call it anterior, which is the bladder compartment, or is it the bowel compartment, and was it the lateral, which is the ureter? And then we can also see the all those ligament compartment, which is the uterosacral, and so that is very important for us to get the whole idea about how bad is the disease, and then how severe is the adhesions, and then how difficult is difficult, because that we can do surgical planning. That is very important. Pre-operative, if we need to offer surgery, we need to have a good pre-operative. Before operation, we have to really need good planning. We cannot go in to do surgery without knowing where all the disease.
Yeah.
So we want to know all the disease, and then we go in with a proper planning and getting, if we need to have multi-discipline involvement, like we need to have a colorectal because he's got a bowel involvement, then we can inform the colorectal surgeon to stand by or to join us in the surgery. If she got the ureter problem or kidney seem to be damaged or you have a ureteric stenosis or obstruction, then we can get the urologist to come and stand by. Same thing if you have bladder involvement. So they can be around so that we can do the surgery, all remove the whole disease all at one sitting. Because this is our aim. The aim is to go in, take away the disease, eradicate the disease, maintain the maximum function of the patient, and what do you call this? Remove disease in total.
So that means because we are talking about treating endometriosis with minimally invasive surgery, but when you involve multi organs, like you mentioned just now, is it still minimally invasive?
Yes, endometriosis, when it comes to endometriosis, it has to be minimally invasive. It is the standard care for endometriosis surgery is minimally invasive. Open surgery is no longer a standard care. In fact, it is can considered substandard because the nature of the disease. So when you have disease which is distorting the whole anatomy of the pelvis, now the ureter, all this main organ is no longer at the right place. So they are distorted because of the contraction, addition. They can even form the everything can be frozen and can become one ball. We don't know which and which. So open surgery might not able to see that because the eye is on the top here, the disease is down there, and they cannot eliminate especially the disease on the nerve or in the ligament. They cannot eliminate because they cannot see. So that's why endometriosis. We look at literatures on, in fact, the trend of the world nowadays on endometriosis. In fact, we already have now endometriosis are become very specialized disease. Yeah, so the approach has to be minimally invasive, either laparoscopically, minimum will be 3D laparoscopic, or a robotic surgery. So this is how robotic surgery now actually has a role, because endometriosis surgery require an advanced skill, it's an advanced disease and require advanced minimally invasive skill, which sometimes laparoscopy unable to meet that skill because the disease sometimes are so difficult, and then they go to certain narrow angle, narrow place that we need to clear disease. Robotically, because of the nature of the robot tool, where they can have 3D magnification, precision, and the arms can also rotate like our feet, like our wrist, like as if we are inside, like we operate ourselves inside there because the arm rotate like our wrist. So we can even handle the very narrow area, and then not only that, we can magnify the disease even how small. We can bring the camera closer and bring camera back. So all these things that it is a benefit of robotic surgery. So perhaps this is one of the best indication for robotic surgery nowadays.
So that means the specialists of this multidisciplinary would be navigating the surgery through these so-called robots.
Yes, now using robotic now is like the urologists using now also, they also train in robotic surgery. We have colorectal also train in robotic surgery. But we want to advocate all surgeons, right, to be trained to do robotic or at least minimally invasive laparoscopy, because there are still surgeons who still not doing minimally invasive, still doing open surgery. So then we cannot do endometriosis surgery having them, because if we do minimally invasive, suddenly we call them and they don't going to do open, right? So I think we want to advocate that all surgeons, to also do minimally invasive, because so that women can have access to multidisciplinary support for endometriosis if they need.
Yes. Okay, so I think next we would, now that they know the whole process and what the surgery would, I think they can visualize how the surgery would go. And I think the next thing that people would wonder would be the recovery, like how the recovery process would go, how long it will take. But I think we will go to that in the next segment.
Hi, I'm Dr. C.S. Low, a urologist with a special interest in laparoscopic and robotic surgery. Now, I've always been passionate about cancer surgery, and over the years I've built up a practice because I enjoy a lot of referrals from my colleagues who choose not to do cancer work. Currently, many of the cancer patients have to travel to many centers to obtain special tests, and no difference for my patients. In Picasso, they will find that they have all the necessary tests, treatment, and care all under one roof. So their care is going to be a lot more convenient, and they can be very assured that all the necessary cutting-edge technology is there. So when you assemble a team of doctors who are leaders in their field and give them all the necessary facilities and equipment that they want in order to deliver their cares to their best ability. Patients who come to Picasso can be assured that indeed they'll be seeing somebody who are expert in the areas of the care that they need, as well as having all the equipments and facilities that their condition needs for their treatment and management. And so it is my wish and the wish of many Picasso's doctors that we will also engage in training at specialist level. As you know, currently there is a shortage of facilities, and it is our hope that we will be able to offer young surgeons and doctors to come to Picasso and finish up their training in very specific areas in healthcare delivery.
Okay guys, welcome back to our last session with Dr. Sharifah. So just now we were going through the whole process of how you start with the consultation and then you go through the surgery if needed. And what I wanted to ask was actually the recovery stage. Maybe some of our audience would be wondering, okay, if I go through this, it is minimally invasive. So how long would it be in terms of recovery? Since if it's a typical surgery, it would take maybe quite a longer time. And just now during our break, we were also talking about the duration of the surgery itself, especially if it's multidisciplinary or multi-organ.
Yeah, the surgery for endometriosis, most of the time, because this involving multi-organ, even it doesn't involve the bladder or involve the vital organs like the bowel, bladder or the kidney, even the uterus itself and the endometriosis and the ligament itself also take long time, duration of hours. Patient have to go under the general anesthesia for the surgery, to able to resect all the disease. Typically it might take between 2 hours to, it can also last up to 8 hours sometimes if multi-organ involvement. Okay. So, however, because of it is minimally invasive, so the patient recovery is very fast. So that is also advantage of minimally invasive, right? Instead of doing a normal conventional open surgery where the patient will be bedridden longer, unable to move, and return function also late and delayed discharge, and the patient has to stay longer in the hospital. But this is like generally minimally invasive, patient recover very fast. Even after evening of the operation, the patient can walk to the bathroom. Even the surgery might take 8 hours, patient can still walk to the bathroom, and the next day they can start mobilizing around, and they can, if the bowel is not being, no surgery on the bowel, then they can even start a diet. Okay. So recovery is fast, minimally invasive, which is good because we want young women, we don't want young women to be bedridden, so they get very fast. So even though how long is the surgery, just a few days ago I had an 8-hour surgery, but the patient just moving, around the next morning itself, and after the next day the patient went home. Yeah, you can be discharged. So that is the good thing about minimally invasive. Comparing laparoscopic and robotic, even better, because robotic surgery give less. This is according to the study, less painful, and then the blood loss of robotic is much more lesser than the laparoscopic, and of course, laparoscopic also doesn't have much of blood loss, but with robotic, the blood loss even lesser. So that's why in the way that when the blood loss is less, so the operation is much safer, because the visibility is good, right? If you operation a lot of blood, sometimes you cannot see, quite dangerous, right? And then make the operation become more difficult. So this blood loss is less, visibility is good. Then recovery of patient also, because not much of loss of hemoglobin, so their recovery also faster. Early go home and return of function. So return function mean like what? So going to what do you call this? Going to the toilet, passing urine, open the bowel, also faster, because that's the advantage of robotic. Because the robotic can visualize, we do call it nerve sparing. We can do nerve sparing surgery. right? So we can trying to see the nerve due to this magnification that we can even spare the nerve, because we can see the nerve, we can spare the nerve.
Spare as in you divide.
I mean, we
the,
just
the
spare it so that we don't cut it, so
Oh,
we know where it
okay.
is,
Yeah,
so
yeah.
we can
Like you put
visualize
it
it.
aside.
Yes, so we push it away so that we don't accidentally, they are not in the way that we when we cut the disease. So we can do nerve sparing surgery. So nerve sparing is important to maintain function, like bladder function. At least patient can pass urine. If the nerve accidentally cut left and right, so patient might not able to pass urine, and then they may have to do self catheterization. Whenever they feel bladder, they have to catheterize themselves and get. So that they can lose function like that. Okay, so that's why robotic is advantage, because they can do nerve sparing surgery. And then also they're talking about fertility sparing, so it's like more refined, more precision. So when we're more precision, we can preserve more ovarian tissue. We don't want to peel off, then we can actually preserve more ovarian tissue, because we can really see the plane, and then we're more precise in cutting the disease rather than cutting some of the ovarian tissue. So we call it fertility sparing. And if they have adenomyosis, if we do the reconstruction, then with robot, because of the hand are moving like our fan, then we can reconstruct or make a suturing back the uterus and reconstruct back almost to perfect, so that there's no gap. So
Inside there, you are stitching it using the
yes,
robotic.
using the robot, inside it. So we can do a perfect reconstruction. Why that's important, this reconstruction? Because the patient is still fertile. If they got pregnant, we have to make sure this uterus can withstand the pregnancy, and then they don't perforate or rupture during labor. So these are important, you see. So that's why robotic, has a place in endometriosis surgery. Not only because it gives all this general benefit in terms of fast recovery, less painful, less blood loss, but it also gives patient, like as I mentioned, precision, safety, and in terms of nerve sparing, better fertility sparing, and these are all part of the advantage of robotic assisted surgery.
So that means it's actually very doable for international patients to come in and seek treatment for this particular
Yes,
disease.
definitely.
Yeah.
Definitely. That's why we have so many international patients who come to Picasso Hospital, and we have people coming from Saudi Arabia, a lot of people coming from Maldives, Brunei, and we also have people come from Canada, from UK.
Wow.
So I have a patient from UK, and she actually has severe endometriosis, until she's so incapacitated, she can only function 2 weeks in the month, and the last 2 weeks she's just busy managing her pain. So because of that, she just cannot progress, and she feels so tired, like life cannot move on. So she need a surgery, and her doctor so no, she need a surgery, and she need robotic surgery. So in UK, apparently their waiting list is 2 years. So patient flown in to Picasso from UK to do surgery with us.
Wow.
All right. So you do surgery with us. Of course we do. Usually we have online consult first. We know their problem. They also have the film that at least we know what stage their disease. They already make a diagnosis, and so it's much easier. So we can actually plan the surgery when they come. They don't need to come twice. So we already know when they're coming. So we already have some kind of connection. I mean the communication with them. So they come and we plan. We will organize their stay and this and that. So we do the surgery with them. Okay, so they surgery with us. So we do robotic surgery for her, and where she need bowel surgery and everything we did all at the same time. She only stayed in the hospital about 5 days. Then after that, she was discharged, to stay nearby, with her husband nearby, like homestay, just for another 3 days. And she see us back before she flown back. I think she flown back on the 10th day to UK, and that's about 12 hours flight, right? Which is 10 days after surgery.
Wow. So it's very doable. It's very
Yes, it's
easy.
very doable. Yes.
But is it for those international patients coming in, are they strictly referral based, or do you get patients who actually search for you, or are there other ways that they found?
I think there are sometimes they are referral based. I have also some referred, but most of the time I ask patient, how do you come? Do you have no referral letter? How do you know us? So they say, oh, we asked ChatGPT.
You asked ChatGPT and
So
then you
so they
appeared.
find ChatGPT and
Yeah.
they said ChatGPT refer them to me. I said, oh, okay. So
Wow.
nowadays I think that the patient now become very smart, right? So
Yeah. They can do their own
they can do
research.
their own
Yeah.
research, and then they also know. Same thing when we research for food restaurant, we also go look, right, you know what the
Yeah,
rate,
the
you know what is the
reviews.
review.
Yeah.
So I think they do the same. So that's why they come to us, and we have many of them as well. Then usually we online consult first. And then from there we have the connection, we know what they need, and then also they come, because we don't want them to come second time because they
Yeah.
come from far away.
Yeah.
So usually they coming, with the plan for surgery, and we will plan for them, and they also at least can buy flight ticket back. They know, they can
Oh.
buy return ticket
Oh.
immediately when they come in. So if not, the ticket will come very expensive, right? So we give them that plan. Okay, you come for 10 days or 7 days, whatever, depend on where from Indonesia. We just tell them, okay, 3 days you can go back to Indonesia. But if the patient is
Even
like,
3 days
yes,
for
yes,
Indonesians.
Indonesia is only 1 hour, right? So it's like, but they like the flight is long flight.
Yeah.
So of course we want them to stay so that we can see them before they fly 1 week to see the wound. So yeah, so these are the things that we do with the patient.
So, when we talk about patients, is there like from your, I think, 30 years of experience, is there one or a few particular patient journey that sticks out to you or that you still remember to this day?
Yeah. Yes, I remember. Actually, I have many patients who actually stick in my head. Okay. And I connected to all of my patients. They have my numbers and all, because I
Oh,
prefer them to message me if they have any issues. And then we know endometriosis usually is a long life, is a kind of issue. Like eventually, one day they may have something they want to ask you. So better ask you first before they
yeah,
just come and wait for you, or maybe ask somebody else and they end up with a problem and then come
yeah.
back to you. So I have them have my numbers. But I think there are many patients, there are some few that really, really motivating me. So I don't mind to do 8 hour surgery, because I see that them being happy,
It's worth it.
after they
Yeah,
get liberated from
yeah.
their pain, from their suffering, and their life move on, after our surgery. So that actually really motivate me. So I have this patient, and they become friends and they become like very connected to me. So she actually young lady, in the 30, and she only child in that family, and both parents not working and depend on her actually for the family support and things like that. And then she has endometriosis. So she is so incapacitated that she cannot do much, to do work, because to bring income revenue for the family, and yet the father having diabetes and then cannot see well, and she and the mother, so she do from home, making cakes, making a kind of a pastry, and she just sell, and that's how online, that's how she get the fund and this and that. So I think that fit her, because she having pain all the time, so she cannot do anything else, so she just have to work from home. So she was too much. She had one surgery done, and then the surgery within 1 year, the disease coming back.
Oh,
I mean, done by other hospital, then disease coming back, and then she just like sick all the time, and have a problem in passing motion, constipation, and many other problem, chronic pelvic pain, nerve pain, and all those kind of things. Okay, so until she come and see me, so when you see her, then she have a stage 4 endometriosis, which involving the bowel as well. The large bowel is affected by the disease, and she got her uterus also got adenomyosis. She got ovarian endometriosis as well. I mean, she has a whole type of endometriosis there. So we did surgery for her. We did I think almost 8 hour surgery also for her, if I'm not mistaken, where we had to remove like 25 centimeter of her large bowel. We had to remove and left the
25
low, yes, yeah,
centimeter.
the large bowel, because they have multifocal. She has a multifocal disease. She was one of the severe case that we have, and then we also removed whatever those endometriosis that on the posterior compartment, that so clear the whole disease for her. Okay, so it took her to recover like 3 months, after the surgery, because the large bowel has been moved.
Yeah.
She got the new bowel habits and this and that. Then after that, she's free from her pain. She's just being so liberated. I mean, they are so different. When they come back to my clinic, you see, when people come with the full of like when they hopeless, feeling
In
hopeless when they come for
pain,
the first time because there have been so many people, so many surgery fail, and then still having pain, and then their life are stuck. So they are very depressed and like so. No energy when they talk to, and they feel like, oh, just another round of doctor will
Yeah.
ask me this and that. So, but then after the surgery, when she come back, you can see the light on the face, the eye was sparkling, and they feel that the pain is not there anymore, and they can not scared anymore to face their month period. You know, some people are
Yeah.
so scared to like. I have some patients who tell me, I better die before my period because I really cannot go through this anymore. You know, some patients even
It's
feel so
that
the pain
painful.
must be so
Yeah.
serious.
Yeah.
So this one, so this is not there anymore. You know, so she can run her life. You know, she finally able. That is her dream. She able to open a cafe for the first time,
Oh.
and then the cafe also she made her own cakes, and then she made her own pastry. You know, so there is a cafe. She and her mother run it, and it's doing so well. And then not only that, because it's doing so well, then she start go for holiday, and then she go for because now she has a more fun, right?
Yeah,
Then she
yeah.
go for holiday, and then she send me the photos. You know, that I'm free from the pain. You know, my life is being liberated. You know, seeing that
Yeah.
is really so give me such a satisfaction, you know. So I feel that okay, I will do another 9 hour surgery. It's okay.
Every day,
Yeah,
even, yeah.
every day. So because of that, we can give people back their life. You know, the young people. You see, their life is being stalled. It's like in prison by the pain and limited. You just can't do much. You can't move. You know, because the disease is holding them for years. You
Yes.
know, so if you can free them, give back their life, I think it's just like you giving them back like from dead to life, like giving them the new life.
Yeah.
So that's motivate me why I want to become endometriosis specialist and endometriosis surgeon. You know, because every time I see my patient, you know, have been liberated, having back their life and so happy, that is really really something.
Because
Yeah, that money cannot
yeah,
buy.
yeah. When you mentioned that she is not able to go on a holiday, I think what many people don't understand is how when you are dealing with this kind of sickness, you are limited by, you know, whenever you want to schedule anything in
Yeah,
your
yeah, yeah.
life,
Their life will
even
be
a simple
around
holiday.
their pain. You know, okay,
Yeah,
when they have plan, okay, is my period there? Oh, we
yeah,
cannot go
yeah,
because my period is coming,
yeah.
and they have to. So their life is just limited, and they cannot move further. You see, just like they're just being under siege. You know, I used to get under siege. You know, by the disease. Yeah. Okay. So this severe this disease. We have
Yes,
to see this disease as something. It's a serious disorder. It's so
yes,
difficult to get to the people, you know, that endometriosis is not just endometriosis. It's not a women problem. It's a disease that take away the life of that
yes.
woman when she's still alive.
I think the
Eventually,
problem,
they actually
yeah.
like walking dead, like you know, the zombies.
I think there's still a stereotype for women whenever we have this kind of pain, is that we are expected to just deal with it
That's a
because it's
problem.
normal. It's normal
Yes.
to have cramps or, you know,
Yeah,
menstrual
yeah.
pain.
Women should have some pain, right? That's
Yeah,
what they say. Women
yeah.
should have some pain, or because you're going to deliver baby. So because deliver baby is painful, so this is just part of it, the package that you before you deliver babies, and as if that we is a right, our rights that we must have pain, you know. But I wonder if men, you know, should you know why men don't have pain, and always wonder what if men has endometriosis.
Yeah.
So things is just like being stereotyped, right? You know, because we think women is weak, so when we have pain, it means that we are cannot tolerate the pain. The pain
Yeah.
is nothing but women you got weak, that's why you got tolerate pain. But when men have pain, that's different.
Yeah.
Because they stereotype, oh, man is strong and whatever. And then when they have pain, so must be so painful. That's
Yeah.
why they now say they have pain. The whole world will go to
Accommodate.
attend to
Yeah.
them, you know. Every fund will go to the men
Yes.
health. Every hospital will start making men pelvic pain screening, everything.
A dedicated
But
sick leave
yes,
for,
yeah,
yeah.
dedicated perhaps. And then you just see prostate, for example. You see
Yeah.
that prostate, every hospital will have in the lift everywhere, prostate package, or something like that. You know, do we have see that anytime like pelvic package for women? You don't see
Maybe
that.
it's still taboo. Is it for us to advertise or just like put it in people's faces on, you know, all these talks about
I mean,
menstruation, endometriosis, just a simple picture of a uterus and the fallopian tubes. Maybe it's still something.
so people think that we talk about women organ is something taboo, but
Yeah.
men organ can talk.
Yeah.
We can talk about it, and then we can be open about it. When it
Yeah.
come to women, oh,
Yeah.
it's a taboo, and we
Yeah.
cannot. I mean, that is not very right. Okay, so
Yeah.
that's why women don't get attention. That's why people don't feel sympathy. When women have pain, people think this is just another
This is
disease,
normal.
but that they actually suffer worse. So this is something that I think is hard to change. But we should continue this awareness to make people aware that endometriosis, I really want to change this endometriosis name, that this multi-system disease,
We start a petition to
is
change the
really
name.
a chronic, progressive, debilitating
Yes.
disease,
Yeah.
that take away the women's life. Okay, what's about that? So can we do something that this is really something?
Yeah.
I tell you one story. This I talked to one CEO last time, a hospital CEO I worked previously. I said that why don't we do endometriosis package or pelvic pain package, for women, okay? Then, I mean, of course, he is a man, and he also has the other men with him and this and that. And then he'd come and look at me. Should we call it? If you call it pelvic pain, people don't know what is pelvic, so people don't understand what is a pelvic. So I give him a look. Also, people know where is prostate. So that because the prostate is all over the place, as if we know where's prostate.
Yeah.
So that shows like it is so naive, that like because when come to women, this thing become
It has
people
to be
don't understand. It has
hush-hush,
to be something like this. But when come to men, all these things can be open, can be discussed or something like that.
Okay, so I think this episode has I hope it opens some eyes for both the ladies and gents.
Yeah.
I think I like to think that we have successfully increased some awareness on both the
Well, we hope so.
the
Yes, yeah.
disease and the stereotype maybe. So basically that's what healthcare or Malaysia healthcare in particular is all about. The treatments that we offer and how so into detail, we go like how you talk about you are still keeping in touch with your patients and how we don't just simply go, oh okay, we do a simple consultation and this is what you have to do. We have basically a village to take care of you, especially when you talk about all the multidisciplinary treatment, right? So I think we have come to the end of our episode today. Thank you so much, Doctor,
Yes,
for your
thank you so
time.
much.
It was so informative for me. I am glad I get to host this episode actually. So thank you so much. Thank you
Yes,
so much,
thank
Doctor.
you.
Bye-bye. Sorry, I just got the cue. Bye-bye. We'll see you at the next episode.